Frustrated with your gut health as you have tried probiotics, eating a clean diet, even going gluten-free, but you still feel bloated, you're having constipation, or worse, diarrhea, and you're just downright exhausted. Well, you are not doing anything wrong. It's just that there are many factors to treating your gut health. Today, I'm going to walk you through the 5 most common reasons gut health advice may seem like it's failing. And by the end of this video, you'll learn steps to take so that your gut health strategies will be optimized. Hi, I'm Dr. Var. I'm a triple board certified physician, and I help people reset their health and reclaim their life by combining conventional with functional, integrative, and lifestyle medicine. Let's dive in. The first reason gut health advice doesn't work is because it may only focus on one aspect of your gut health instead of the entire digestive system. When most people think about gut health, they may only focus on the microbiome. And yes, that is very important, but your gut microbiome is just one aspect of your gut health. We also need to remove any inflammatory triggers, optimize your digestion and absorption, and make sure that your gut lining is intact. Thus, you may need more than just a probiotic food or a probiotic supplement to really feel good. Your digestion starts in your mouth with chewing. You have to break down your foods into smaller components to make it easier on the rest of your digestive system. The other thing is your saliva has enzymes in it that help start to digest your starches. So it's already working on breaking down the cell walls of your food. And then it goes to the stomach where there's stomach acid to help digest your proteins. Then it goes to the small intestine where you have enzymes from the pancreas to help digest your fats, proteins, and starches, and bile that also helps digest your fats. So if digestion is not optimized, then you have all of these undigested food stuff in your small intestine longer than it should be. And then that can cause inflammation in your gut, can affect the gut lining, can affect the microbiome. And so if you don't fix it, even if you take probiotic, you're not going to really be doing anything if you're not fixing that underlying problem. Here's your action step for this first part, is to make sure you chew your food about 15 to 20 times. Most of us chew our food about 5 times and then we swallow. So this is an easy thing that you can do and it's free. But you just want to get that mechanical breakdown and get the saliva going so it'll start digesting your starches. You also want to add digestive foods. Foods that help your digestion are pineapple, papaya, and ginger. So just add those to your meals and that also can help. The second reason gut health advice may fail is because people assume that if a food is considered healthy, it can't possibly be causing symptoms. But here's the reality. There are some conditions where even healthy food can trigger symptoms. Here are 3 common examples. Number 1 is histamine intolerance. Foods like aged cheeses, fermented foods, wine, avocados, and even bone broth are high in histamine. For someone with a healthy gut, these foods are fine and even beneficial. But if your gut is compromised to where you have a histamine intolerance, and that means that your body does not have enough of a particular enzyme called DAO, diamine oxidase, to break down the histamine that you get from foods. If you have high histamine, you might get flushing, itching, migraines, and anxiety. The second example is if you have a condition called SIBO, S-I-B-O. Sometimes even in conventional medicine, they link it with IBS. So they will put you on something called a low FODMAP diet. FODMAPs are fermentable carbohydrates that are found in foods like onions, garlic, apples, and legumes. And so people who eat these foods, because of the conditions that they have, particularly SIBO, they have bacteria in their small intestine that shouldn't be there, and it ferments these healthy foods. It produces a gas. So then people tend to feel bloated. And one classic thing I hear in people who have SIBO is that they wake up fine, and then as soon as they start eating, they start feeling more and more bloated. And by the end of the night, their pants don't fit. They feel like they're 9 million months pregnant. And so when people tell me that, I usually will check them for SIBO. And then the third example are food sensitivities. You can develop a food sensitivity to anything, even broccoli, believe it or not. So what happens is there's already something going on in your gut, specifically intestinal permeability or leaky gut. And when that happens, that can increase your risk for developing food sensitivities. And the more you eat that food, the more inflamed your gut gets. And if it's a food that you don't realize is making you feel bad, you will probably continue to eat it. And so even if you're taking your digestive enzyme, you're taking your probiotic, you might feel a little better, but you may not feel completely better until you actually really figure out what your food sensitivities are. There are food sensitivity testing. So food sensitivity is different than a food allergy. A food sensitivity, you can have a non-specific symptom up to 3 days, whether it's a gut issue. Some people will have headaches, mood changes, skin rashes. You don't always have to have GI symptoms, even though it stems from having a GI problem. Food sensitivity testing isn't always 100%. So that's the downside to it, is that it's not always accurate. So I just use it as a guide, and it has been helpful clinically. So here's your action step. Make notice if there are any particular foods that you eat commonly that seem to trigger symptoms within 3 days of eating it. And this can be tricky, but the best way is just to keep a food journal. And then when you have a symptom like a headache or you have diarrhea, you can kind of see, is every time I'm getting diarrhea, am I eating this particular food? The most common food sensitivities are gluten, dairy, and soy. Sometimes it still is hard to figure out. And then notice if you're eating any of those high histamine foods like avocados, for example, you start to get flushed, then you might have a histamine intolerance. And if you do, we treat histamine intolerance by, working on what's going on in your gut, because that's usually the root cause. And then if you feel bloated, you want to talk to your healthcare provider and see if you should get tested for SIBO. So the third reason on why gut health advice may fail is that some people just rely on supplements to try to help them feel better without removing inflammatory foods. So I'll have patients that will be taking their probiotic, digestive enzyme, the gut healing supplements like glutamine and zinc, but they're still eating the ultra processed foods, excess sugar, alcohol. The supplements aren't a cure-all. They can help support you as long as you're working on your diet and trying to remove the triggers and working on the digestion and your microbiome. But supplements by itself without taking some of these other actions may not be able to fix what's going on. So here's your action step. For at least 2 weeks, avoid ultra processed foods. So that's anything that comes in a box that you have to prepare, fast foods, packaged foods. Avoid any excess sugar or alcohol, and add more gut healing foods. Add plenty of different colors of fruits, vegetables. They have components in them that are healing for your gut. Of course, be mindful if you have SIBO or certain food sensitivities, like I mentioned earlier. Omega-3 rich foods like salmon, sardines, walnuts, chia, hemp, and ground flax seeds are good sources of omega-3. Turmeric, green tea, those are all good healing foods for your gut. The fourth reason is stress. That's one of the most overlooked reasons for gut health dysfunction. Now, when you're in a chronic stress state, several things happen in your gut. First, cortisol rises, and when you have elevated cortisol, this can impact your microbiome. Then the bad bacteria are going to overgrow, and there's going to be less beneficial bacteria. So you'll have this imbalance, or what we call dysbiosis. Stress can also alter your immune function and can also increase your risk for intestinal permeability, or what it's commonly known as is leaky gut. And the other thing is stress will slow your gut down. So then when you don't have good gut motility, it can affect your microbiome, cause inflammation, and can even affect detoxification. So it's so important to have practices in place that help you control your stress. Stress is always going to be there. One of the easiest things that I always recommend and that I do myself is to exhale longer than you inhale. Because when you inhale, that increases your heart rate. And when you exhale, it lowers it. So when you exhale longer, you're lowering your heart rate, and that may tend to make you feel more relaxed. Your action step is to do this every day and commit to at least 30 days. And then the last reason that your gut health strategies may not be working is because you are being exposed to certain environmental toxins. There are toxins everywhere. We are just encountering a lot of different chemicals that didn't exist 100 years ago. There are endocrine disrupting chemicals. These are specifically found in plastics, food packagings, even the receipts, nonstick cookware, and personal care products. So these chemicals from these products can interfere with your hormones, and even studies have shown that particular ones like BPA or phthalates can alter your gut microbiome, increase your risk for intestinal permeability, and promote inflammation and even weight gain. They even call them obesogens. And there's many other things that we're exposed to, that we breathe in, that we put on our skin. But the bottom line is we're exposed to a lot of different things in our environment. And the important thing is to make sure that we are detoxing well. Some people can be exposed to a lot of different things, but they're detoxing well, so it doesn't have as much of an impact. And there are other people, they just are exposed to a couple things and they do not detox well, and then it's a bigger impact. Here are your action steps. If you are drinking out of a plastic water bottle, try to switch to a glass or stainless steel water bottle. Avoid heating plastics in the microwave or leaving a plastic water bottle in the car, because the plastics itself can leach these chemicals into whatever it's housing. And then if you heat it, that even accelerates it. So those are the reasons why your gut health strategies may not be working. Thanks for listening or watching, and have a fantastic day.